All right, let's see where you really stand. This is part 2 of our full mock exam, covering all 4 domains just like the actual test. Quick heads up, if you haven't seen part 1 yet, check the link in the description for another 90 completely unique questions to test yourself. This session, here is how we do it. I'll show you a question, give you 5 seconds on the clock, and then reveal the answer with a breakdown so it actually makes sense. This is PTCB Prep Guide. We're here to guide you until you see that CPhT badge on your chest. Let's do this. We are kicking things off with Domain 1, which covers medications. For our first scenario, we are looking at patient safety regarding allergies. Question number 1. A patient with a severe sulfa allergy should potentially avoid which of the following diuretics? For option A, we have ethacrynic acid. Option B is spironolactone. Option C is amiloride. And option D is furosemide. The correct answer here is D, furosemide. You have to be careful with this one, because furosemide, also known as Lasix, is a loop diuretic that actually contains a sulfonamide group. If the allergy is severe, ethacrynic acid is usually the safe alternative. Next, let's talk about specific administration instructions. At number 2, which antifungal medication requires an acidic environment for absorption and is often recommended to be taken with a cola beverage? Is it A, ketoconazole? How about B, fluconazole? Maybe C, nystatin? Or D, terbinafine? If you picked A, you got it. Ketoconazole needs acid to work properly. So if a patient has low stomach acid, a soda can actually help the medicine absorb. This next one focuses on serious side effects. Question number 3 asks, which class of antibiotics is associated with a risk of tendon rupture? We have A, macrolides, B, fluoroquinolones, C, tetracyclines, and D, cephalosporins. The answer is B. Fluoroquinolones, like Cipro and Levaquin, carry a black box warning specifically for tendinitis and tendon rupture. Let's test your knowledge of brand and generic names. Coming in at number 4, a patient is prescribed Januvia. What is the generic name for this medication used to treat type 2 diabetes? Is it A, saxagliptin, B, alogliptin, C, sitagliptin, or D, linagliptin? Option C is the winner. Januvia is the brand name for sitagliptin. A good trick is to remember that the gliptin suffix usually points to this class of diabetes drugs. Here is a classic drug-herb interaction. At number 5, which herbal supplement is commonly used for depression but interacts negatively with SSRIs? Your choices are A, ginkgo biloba, B, echinacea, C, saw palmetto, or D, St. John's wort. The correct choice is D, St. John's wort. This is a classic trap. St. John's wort increases serotonin, so taking it with an antidepressant can lead to a dangerous condition called serotonin syndrome. Now for a true or false on administration technique. Question number 6. Bisphosphonates like alendronate must be taken with a full glass of water, and the patient must remain upright for 30 minutes. This statement is true. These drugs can cause severe irritation to the esophagus, so gravity helps keep the pill down where it belongs. Let's look at overdose management. For number 7, which medication is a reversal agent used for benzodiazepine overdose? Is it A, flumazenil, B, naloxone, C, protamine sulfate, or D, vitamin K? The answer is A, flumazenil. Don't confuse this with naloxone, which reverses opioids. Flumazenil is specific to benzos. Here is an important interaction involving blood thinners. Question number 8. A patient is taking Plavix. Which proton pump inhibitor is generally avoided due to CYP2C19 inhibition, which reduces Plavix efficacy? Is it A, pantoprazole, B, famotidine, C, omeprazole, or D, dexlansoprazole? The answer is C, omeprazole. It inhibits the enzyme that Plavix needs to become active in the body, which might leave the patient unprotected against clots. Switching gears to respiratory medications. At number 9, which of the following is considered a long-acting beta agonist, or LABA? Is it A, albuterol, B, levobuterol, C, ipratropium, or D, salmeterol? The correct answer is D, salmeterol. Remember, albuterol is for rescue, but salmeterol is for long-term maintenance. Let's verify your knowledge of controlled substance schedules. Question number 10. Ambien, or zolpidem, is classified as a sedative hypnotic. What schedule is this drug? Is it A, Schedule 2, B, Schedule 4, C, Schedule 3, or D, Schedule 5? It is B, Schedule 4. It has a potential for abuse, but less so than the heavy painkillers in Schedule 2. This next question deals with men's health. Coming up at number 11, which medication is indicated for the treatment of benign prostatic hyperplasia and is an alpha-1 blocker? We have A, tamsulosin, B, finasteride, C, dutasteride, and D, sildenafil. The answer is A, tamsulosin, also known as Flomax. It relaxes the muscles to help with flow. Back to generic substitutions. For number 12, the generic name for Singulair is A, zafirlukast, B, montelukast, C, loratadine, or D, fluticasone. The answer is B, montelukast. It is commonly used for asthma and allergies. Let's break down the ingredients of a common combination drug. Question number 13. A patient presents a prescription for Suboxone. What two drugs does this contain? Is it A, oxycodone and acetaminophen, B, hydrocodone and ibuprofen, C, methadone and naloxone, or D, buprenorphine and naloxone? Option D is correct. The naloxone is added to prevent people from injecting the medication to get high. Here is a side effect question you will see often. At number 14, which antihypertensive medication can cause a dry, hacking cough as a common side effect? Is it A, valsartan, B, amlodipine, C, enalapril, or D, propranolol? The answer is C, enalapril. That pril suffix tells you it is an ACE inhibitor, and that dry cough is the most notorious side effect of that class. Question number 15. Which vitamin is often prescribed to reduce the neurotoxic effects, like neuropathy, of isoniazid therapy? A, vitamin B6, B, vitamin B1, C, vitamin B12, or D, vitamin C? The answer is A, vitamin B6, also called pyridoxine. Isoniazid depletes B6, so we have to replace it. Let's check your cardiac knowledge. For number 16, digoxin toxicity is increased by low levels of which electrolyte? Is it A, sodium, B, chloride, C, calcium, or D, potassium? The answer is D, potassium. Hypokalemia makes the heart much more sensitive to digoxin, which can be dangerous. Moving on to lifestyle medications. At number 17, which medication is a PDE5 inhibitor used for erectile dysfunction? Is it A, terazosin, B, tadalafil, C, tamsulosin, or D, tolterodine? Option B, tadalafil, is the correct one. You might know it as Cialis. Here is a true or false about drug classification. Question number 18. True or false? Victoza, or liraglutide, is an insulin product. This is false. Victoza helps the body release insulin, but it is actually a GLP-1 agonist, not insulin itself. Let's look at drug suffixes. Coming in at number 19, which class of drugs often ends in the suffix prazole? Is it A, proton pump inhibitors, B, ACE inhibitors, C. H2 antagonists, or D. Beta blockers? The answer is A. Proton pump inhibitors. Think omeprazole or pantoprazole. This next one involves a strict alcohol warning. Question number 20. A patient is prescribed Flagyl. They should be counseled to avoid alcohol to prevent a disulfiram-like reaction. What is the generic name? Is it A. metformin, B. methotrexate, C. minocycline, or D. metronidazole? The answer is D. metronidazole. Mixing this with alcohol can cause severe vomiting and flushing. Let's talk about ADHD treatments. At number 21, which medication is used for the treatment of ADHD and is a C2 stimulant? A. Atomoxetine, B. Lisdexamfetamine, C. modafinil, or D. bupropion? The correct choice is B. Lisdexamfetamine, which is Vyvanse. Atomoxetine treats ADHD too, but it isn't a controlled stimulant. Here is a pediatric safety question. For number 22, which antibiotic should not be given to children under 8 years old due to potential tooth discoloration? Is it A. amoxicillin, B. cephalexin, C. doxycycline, or D. azithromycin? The answer is C. doxycycline. Tetracyclines can bind to calcium in teeth and turn them gray or yellow. Let's identify therapeutic classes. Question number 23. What is the therapeutic classification of Zofran or ondansetron? A. Antihistamine, B. Antipsychotic, C. Antidepressant, or D. Antiemetic? The answer is D. Antiemetic. It is the go-to drug for nausea and vomiting. This one is about accessibility. At number 24, which insulin can be purchased without a prescription in some states? A. Aspart, B. Regular, C. Glargine, or D. Detamir? The answer is B. Regular insulin. Older insulins like Regular and NPH are often available OTC. Let's verify another brand name. Question number 25. Wellbutrin is the brand name for A. bupropion, B. buspirone, C. fluoxetine, or D. venlafaxine? The answer is A. bupropion. Moving to rheumatology medications. For number 26, which of the following is a non-biologic DMARD used for rheumatoid arthritis? A. methotrexate, B. etanercept, C. adalimumab, or D. infliximab? The answer is A. methotrexate. The others are complex biologics, but methotrexate is a traditional drug. We are checking lab values now. At number 27, a patient taking Coumadin has an INR of 5.0. This indicates what? A. The blood is too thick. B. The INR is normal. C. The blood is too thin. Or D. The patient needs vitamin K immediately. The answer is C. The blood is too thin. An INR of 5 is way above the target range, meaning they are at risk of bleeding. Let's distinguish between NSAID types. Question number 28. Which drug is a COX-2 selective NSAID? A. Naproxen, B. Meloxicam, C. Diclofenac, or D. celecoxib? The answer is D. celecoxib. It's easier on the stomach than the others. Here's a controlled substance indication question. Coming up at number 29, pregabalin or Lyrica is a CV-controlled substance primarily used for what? A. Hypertension, B. Depression, C. Nerve pain, or D. Asthma? Option C is correct. It treats neuropathic pain and fibromyalgia. And wrapping up the first section with thyroid health. Question number 30. Which medication is used to treat hyperthyroidism? A. Methimazole. B. Levothyroxine. C. Liothyronine. Or D. Metformin. The answer is A. Methimazole. Be careful not to mix this up with levothyroxine, which treats low thyroid. Methimazole stops the thyroid from making too much hormone. Let's test your knowledge of sun sensitivity. Question number 31 is a true or false? Topical retinoids like tretinoin increase sun sensitivity. That is true. Patients need to wear sunscreen because their skin will burn much faster. We need to identify diuretic classes here. At number 32, which medication is considered a potassium-sparing diuretic? A. Torsemide. B. Bumetanide. C. Chlorthalidone. Or D. Triamterene. The answer is D. Triamterene. It helps you pee without losing all your potassium. This next one focuses on neurologic conditions. For number 33, what is the primary indication for donepezil or Aricept? A. Parkinson's. B. Multiple sclerosis. C. Alzheimer's. Or D. Epilepsy. The answer is C. Alzheimer's disease. Let's talk about contraindications. Question number 34. Which vaccine is contraindicated in patients with a severe allergy to eggs? A. Hepatitis B, yellow fever. C. Varicella. Or D. Pneumococcal. The answer is B. Yellow fever. It is grown in eggs, so the allergy risk is high. Here is a dispensing requirement you must know. At number 35, a stat dose of nitroglycerin sublingual tablets is usually dispensed in what? A. The original glass bottle. B. A child-resistant vial. C. A blister pack. Or D. A cup. It is A. The original glass bottle. Nitro sticks to plastic and breaks down in light, so don't move it to a vial. Question number 36. Which antipsychotic requires regular blood monitoring for a granulocytosis? A. Quetiapine. B. Risperidone. C. Aripiprazole. Or D. Clozapine. The answer is D. Clozapine. It can dangerously lower white blood cells, so patients need strict monitoring. All right, switching gears to Domain 2, federal requirements. For number 37, according to federal law, a C2 prescription expires how long after the date of issuance? Is it A. Federal law does not set a specific expiration. B. 1 year. C. 7 days. Or D. 6 months? The answer is A. This is tricky because many states set a 6-month limit, but the federal law itself actually has no expiration date for CIIs. Let's review DEA paperwork. At number 38, which DEA form is required for a pharmacy to report the theft or significant loss of controlled substances? A. Form 41. B. Form 222. C. Form 106. Or D. Form 224. The answer is C. Form 106. Remember, 106 is for theft, 41 is for destruction. This next question covers PSE sales limits. Question number 39. Under the Combat Methamphetamine Epidemic Act, what is the daily sales limit for pseudoephedrine? A. 7.5 grams. B. 3.6 grams. C. 9 grams. Or D. 6 grams. It is B. 3.6 grams per day. Here is a true or false regarding C2 alterations. Number 40. True or false? A pharmacist may change the patient's name on a C2 prescription after consulting the prescriber. This is false. The patient's name, the drug name, and the doctor's signature are the three things you generally cannot change on a C2. We are looking at federal acts now. At number 41, which act requires pharmacists to offer counseling to Medicaid patients? A. HIPAA. B. FDCA. C. MMA. Or D. OBRA 90. The answer is D. OBRA 90. Let's verify you know your DEA forms. Question number 42. Which copy of the DEA Form 222 is kept by the purchaser, which is usually the pharmacy? A. Copy 3 blue. B. Copy 2 green. C. Copy 1 brown. Or D. The original only. The answer is A. The blue copy. The pharmacy keeps the blue one for their records. For number 43, a prescription for Fiorichet is federally classified as what? A. C2. B. Non-controlled. C. C3. Or D. CIV. The answer is B. Non-controlled. While Fiorinol is a control, Fiorichet is exempt under federal law. Let's identify DEA number prefixes. At number 44, what letter usually precedes the DEA number of a mid-level practitioner, like a nurse practitioner? A, the letter A, B, the letter B, C, the letter X, or D, the letter M? The answer is D. M stands for mid-level. Question number 45. Which USP chapter governs the handling of hazardous drugs? A. USP 800. B. USP 797. C. USP 795. Or D. USP 825. The answer is A. USP 800. Just remember, 800 is for hazardous. Here is a question about inventory frequency. At number 46, how often must a controlled substance inventory be performed according to federal law? A. Every year. B. Every 3 years. C. Every 2 years. Or D. Every 5 years. The answer is C. It is a biennial inventory, meaning every 2 years. Let's review transfer regulations. For number 47, prescriptions for C3 and CIV drugs may be transferred between pharmacies sharing a real-time online database how many times? A. 1 time only. B. Not at all. C. Only if the doctor approves. Or D. Up to the maximum refills permitted. The answer is D. If the computers are linked, you can transfer it back and forth as much as needed up to the max refills. Question number 48. True or false? The federal caution transfer warning is required on the label of Schedule 5 drugs. This is false. It is required for Schedules 2, 3, and 4, but technically not for Schedule 5. Let's move into Domain 3 regarding patient safety. At number 49, which of the following is a pair often confused? Is it A. Hydralazine hydroxyzine? B. Amoxicillin and ampicillin? C. Lisinopril and losartan? Or D. Metformin and metoprolol? The answer is A. Hydralazine and hydroxyzine are the classic trap here, because the names look incredibly similar, but one is for blood pressure and the other is for itching or anxiety. Question number 50. When recalling a drug, which class indicates a reasonable probability of serious adverse health consequences or death? A. Class 2. B. Class 3. C. Class 1. Or D. Class 4? The correct answer is C. Class 1. Remember, just like in a race, number 1 is the biggest deal. Class 1. is the most severe recall type. This next one deals with compounding expirations. For number 51, what is the maximum beyond use date for a water-containing oral formulation prepared from solid ingredients? A. 30 days. B. 6 months. C. 1 year. Or D. 14 days refrigerated. The answer is D. Because water breeds bacteria, you only get 14 days, and it has to stay in the fridge. Here is a practical scenario on the job. At number 52, a technician drops a pill on the floor while counting. The appropriate action is A. Blow on it and put it back. B. Discard it into the waste bin and replace it. C. Wipe it with alcohol. Or D. Put it in return to stock. Hopefully you picked B. Once it hits the floor, it's trash. Never dispense a dropped pill. Let's check your knowledge of safety lists. Question number 53. Which organization publishes the Do Not Crush list? A. ISMP. B. FDA. C. TJC. Or D. USP. The answer is A. The ISMP, or Institute for Safe Medication Practices. This involves best practices in writing prescriptions. For number 54, true or false? Trailing zeros like writing 5.0 milligrams are discouraged in prescription writing. That is true. If someone misses the decimal point, 5.0 looks like 50, which is a massive overdose. Here is a counseling point on urine discoloration. At number 55, a patient taking pyridium or phenazopyridine should be warned that it may cause what? A. Drowsiness. B. Insomnia. C. Red or orange discoloration of urine. Or D. Blue vision. The answer is C. This drug is a dye, and it will turn their urine a bright, alarming orange color. It's harmless, but they need to expect it. We are checking aseptic technique. Question number 56. When cleaning a laminar flow hood, which direction should you clean? A. Front to back, side to side. B. Circular motion. C. Bottom to top. Or D. Back to front, side to side. The answer is D. You always clean from the cleanest part, the back filter, toward the dirty part, the front user. Let's talk about air quality. For number 57, HEPA filters in a laminar flow hood remove particles that are how big? A. 0.3 microns or larger. B. 0.1 microns. C. 0.5 microns. Or D. 1 micron. The standard is A. 0.3 microns. This is a critical antidote question. At number 58, which antidote is used for acetaminophen or Tylenol toxicity? A. Naloxone. B. Flumazenil. C. N-acetylcysteine. Or D. Deferoxamine. The answer is C. N-acetylcysteine. It protects the liver from shutting down. Here is a safety terminology check. Question number 59. A near miss is defined as what? A. An error that reached the patient but caused no harm. B. An error that caused significant harm. C. A side effect. Or D. An error that was caught before it reached the patient. The answer is D. A near miss is a good catch. It never made it to the patient. And wrapping up this section with high-risk meds. At number 60, which medication is considered high alert by ISMP? A. Methotrexate. B. Ibuprofen. C. Amoxicillin. Or D. Loratadine. The answer is A. Methotrexate. Because it is usually taken weekly, accidentally taking it daily can be fatal. Let's see if you know your reference books. At number 61, what does the Orange Book reference? A. Drug pricing. B. Immunizations. C. Therapeutic equivalents. Or D. Compounding. The answer is C. The Orange Book tells you if a generic is A, B rated and safe to substitute for the brand. Question number 62. If a patient is allergic to penicillin, which cephalosporin has the highest cross-reactivity risk? A. Third generation. B. First generation. C. Fourth generation. Or D. Fifth generation. The answer is B. First generation. Drugs like cephalexin are chemically most similar to penicillin. Here is a true or false about insulin mixing. For number 63. True or false, insulin glargine or Lantus can be mixed in the same syringe with regular insulin. This is false. Lantus has a unique pH and will crystallize if you mix it. It always goes in a separate syringe. Let's talk about error prevention strategies. At number 64, root cause analysis is a process used to do what? A. Punish the employee. B. Calculate costs. C. Report to the DEA. Or D. Identify systemic causes of error. The answer is D. We don't blame the person. We fix the system. Question number 65. Which number typically indicates the medication batch to trace recalls? A. Lot number. B. Expiration. C. NDC. Or D. DEA number. It is A. The lot number. We need to know the order of garbing. For number 66, which PPE must be donned first when entering a clean room for sterile compounding? A. Face mask. B. Shoe covers. C. Sterile gloves. Or D. Gown. The correct order is dirtiest to cleanest, so B. Shoe covers come first. Here is a compounding technique question. At number 67, a patient complains that their compounded cream is gritty. This is a sign of improper what? A. Incompatibility. B. Trituration. C. Weighing. Or D. Levigation. The answer is D. Levigation. That's the process of wetting the powder to make a smooth paste. Let's look at expanded technician roles. Question number 68. The Tech Check Tech program is allowed in some states for what? A. Refill medications in institutional settings. B. Controlled substances. C. All prescriptions. Or D. Verbal orders. The answer is A. It's usually restricted to hospital refills or automated cabinets. For number 69, which organization manages the MedWatch program? A. ISMP. B. FDA. C. CDC. Or D. WHO. The answer is B. The FDA. At number 70, counting trays should be cleaned with alcohol immediately after counting what? A. Any tablet. B. Capsules. C. Sulfa drugs or penicillin. Or D. Controlled substances. The answer is C. You have to clean off the dust from sulfa or penicillin so the next patient doesn't have an allergic reaction. Here is a common hospital acronym. Question number 71. TPN stands for A. Total peripheral nutrition. B. Total patient nutrition. C. Total protein nutrition. Or D. Total parenteral nutrition. The answer is D. Total parenteral nutrition. Let's finish the safety domain with this one. For number 72, true or false, single-dose vials can be reused if stored in the refrigerator. This is false. They have no preservatives, so once they're open, they're done. Now entering Domain 4, Order Entry and Processing. At number 73, interpret the SIG, 1 GTT OS bid. A. 1 drop right eye twice daily. B. 1 drop both eyes. C. 1 drop left ear. Or D. 1 drop left eye twice daily. The answer is D. GTT is drop, OS is left eye. So, 1 drop in the left eye twice daily. Get ready for a standard conversion? Question number 74. How many milliliters are in a pint? A. 473. B. 360. C. 240. Or D. 946. The answer is A. 473 milliliters. Sometimes rounded to 480, but 473 is the precise number. Here's an IV flow rate calculation. For number 75, a 1-liter IV bag is running at 125 milliliters per hour. How long will it last? A. 4 hours. B. 8 hours. C. 6 hours. Or D. 12 hours. The answer is B. 8 hours. 1 liter is 1,000 milliliters. If you divide 1,000 by 125, you get 8. Let's decode the NDC number. At number 76, which segment of the NDC code identifies the package size? A. First. B. Second. C. None. Or D. Third. It is D. The third segment. Remember, labeler, product, size. Question number 77. Convert 165 pounds to kilograms. A. 65. B. 82.5. C. 75. Or D. 90. The answer is C. 75 kilograms. You just divide the pounds by 2.2. Here is a total volume calculation. For number 78, you have a script for amoxicillin 250 milligrams per 5 milliliters. The SIG is 1 teaspoon TID times 10 days. What volume should be dispensed? A. 150 milliliters. B. 100 milliliters. C. 200 milliliters. Or D. 250 milliliters. The answer is A. 150 milliliters. 1 teaspoon is 5 milliliters. TID means 3 times a day. So that's 15 milliliters a day times 10 days equals 150. Let's check another Latin abbreviation. At number 79, the abbreviation AD in a prescription SIG means A. Left ear. B. Both ears. C. Up to. Or D. Right ear. The answer is D. Right ear. Think AD for Oris Dextra. Question number 80. Which calculation method is used to mix 2 different concentrations to get an intermediate strength? A. Young's rule. B. Alligation. C. Clark's rule. Or D. Freed's rule. The answer is B. Alligation. That's the tic-tac-toe grid method. Up next is a common insurance rejection scenario. At number 81, an insurance rejection saying refill too soon usually indicates what? A. Filling before calculated days supply elapsed. B. Drug not covered. C. No refills left. Or D. Doctor not in network. The answer is A. The patient usually has to use up about 75% of the meds before insurance pays for more. Let's test your knowledge of SIG codes for this next one. Question number 82. What is the meaning of the abbreviation HS? A. Morning. B. Half strength. C. Bedtime. Or D. High sugar. The answer is C. At bedtime. Get your mental math ready for a conversion question. For number 83, how many grains are in 300 milligrams of aspirin? A, 2, B, 4, C, 10, or D, 5? The answer is D, 5 grains. 1 grain is about 60 to 65 milligrams. 300 divided by 60 is 5. Back to insurance terminology. At number 84, a patient pays a fixed dollar amount, say $10 per prescription. This is A, copay, B, premium, C, deductible, or D, coinsurance. That is A, copay. Here is a quick calculation question involving a steroid taper. Question number 85. Calculate the quantity for a prednisone taper. 4 tabs today, 3 tabs tomorrow, 2 tabs day 3, 1 tab day 4, then stop. A, 8 tablets, B, 12, C, 10, or D, 14. The answer is C, 10 tablets. Just add 4 plus 3 plus 2 plus 1. Let's do a quick true or false on industry acronyms. For number 86, true or false, PBM stands for Pharmacy Benefits Manager. That is true. Moving on to proper labeling. At number 87, which auxiliary label is most appropriate for a suspension? A, external use only, B, drowsiness, C, empty stomach, or D, shake well. The answer is D, shake well. The powder settles at the bottom, so you have to shake it to get the right dose. Here is another abbreviation you will see every single day. Question number 88. OU stands for A, right ear, B, both eyes, C, left eye, or D, both ears. The answer is B, both eyes. U stands for U-turkey, which means both. This next one might look tricky, but it is all about ratio strength. At number 89, if a solution is a 1 to 1,000 strength, how many mg are in 1 milliliter? A, 0.1 milligrams, B, 10 milligrams, C, 1 milligram, or D, 100 milligrams. The answer is C, 1 milligram. A 1 to 1,000 ratio means 1 gram in 1,000 milliliters. Since 1 gram is 1,000 milligrams, you have 1,000 milligrams in 1,000 milliliters, which simplifies to 1 milligram per milliliter. And for the grand finale, let's calculate a retail price. Question number 90. A prescription costs the pharmacy $50. The dispensing fee is $5. The pharmacy wants a 20% profit margin on the cost. What is the retail price? A, $60, B, $55, C, $70, or D, $65. The answer is D, $65. First, 20% of $50 is $10 profit. Add the $50 cost plus the $10 profit plus the $5 fee, and you get $65. And that wraps up today's mock exam. How did you do? If you found some of these tricky, don't sweat it. That's exactly why we're practicing now instead of on test day. Drop a comment below with your score. I want to see who's ready to pass. If you found this helpful, hit that like button and make sure to subscribe so you don't miss the next practice set. Keep studying, stay confident, and I'll see you in the next video. You got this. Also, check out our other videos. To do that, click that channel logo in the middle of the screen to subscribe. Click on the cards to choose your next watch. Thank you again for watching, and good luck!